Hello everyone. It's a matter of immense pleasure for Thieme Medical Publishers to have dignitaries Dr. Yatin Mehta, Dr. Navin Nanda, Dr. Poonam Malhotra Kapoor with us, and I'm joined by Director Publishing of Thieme Medical Publishers, Ms. RItu Sharma. This is the occasion where the publishing partnership of Thieme Medical Publishers with the Simulation Society is taking a new leap. 2 years back, with Dr. Poonam Malhotra Kapoor, we initiated the Journal of Cardiac Critical Care in supervision of Dr. Yatin Mehta and Dr. Navin Nanda, which is really going well. And today we have the privilege to launch the cover of our upcoming textbook of cardiac critical care. Dr. Poonam, how the journey has been for the society, the journal, and now the book?
Well, for the society, we've made leaps and bounds with so many fellowships and courses. For the journal, it's come up amazingly well. People do not believe in a new journal, and I'm lucky with good authors supporting and excellent reviewers. The editorial board authorship that was sought and given by very senior stalwarts probably has helped. So has the commitment from Thieme Publishers. You guys have been very consistent. When I fail and we fail in submitting in time, you people do pressurize us in a very right way. So we're thankful to Thieme for that. But surprisingly, no one considered it a new journal. No one was apprehensive that this is not an index journal yet. And I do get 14 to 15 publications. I reject 2, 3. I wish I get 20, and I reject more so that our indexing gets expedited. I am thankful to our reviewers. Most of them are very robust and very uplifted academicians who are reviewers. Some of the authors, I have to thank Dr. Kanchi Muralidhar. I think he's been our best author so far, followed by Dr. Yatin Mehta. Dr. Nanda has always given 1 or 2 articles, so has Dr. Kapoor. A lot of people believe that I have to send this talk of mine or this review of mine as a review for JCC. Mm-hmm. That probably belief in a journal in that subspecialty which was missing so far has tremendously helped the journal to come up. We are soon going to be launching our 5th issue, which is going to be a bit delayed, but we've otherwise last 2 years been on time.
Definitely. So how the idea came up for the textbook of cardiac critical care, and how you see the book going forward?
Well, cardiac critical care is a very niche branch. Critical care in India is a very established society. You stand with Dr. Yatin Mehta, who is the president of the Indian Society of Critical Care. Cardiac anesthesia has been there for 20 years now. So cardiac critical care is a very new branch, and every student wants to know what is special in it. So that textbook was missing. And since the journal's name is the same, this textbook is the need of the hour and very pertinent at this stage when we are coming up as a new fraternity and a society. And you need cardiologists, because today most of us, the cardiac anesthetists and intensivists, are working on a 60-40 basis. We used to be 80% with the surgeons and 20 with the cardiologists. Today we are more 40-50% with the cardiologists in the cath lab, and equally so in the OR. So when you're seeing this mixture of cath lab cases come up, I think cardiac critical care is there. We need cardiologists with us.
That's really great. Dr. Mehta, how you see the book shaping up, and how it would cater to the growing needs of patients, healthcare and management in the country?
See, at the moment, if you look at it, the general critical care is very well organized. Structurally, education, training, publications. Cardiac critical care is relatively new, although cardiology is one of the oldest specialties and so is cardiac surgery. But traditionally, the cardiac surgeons are the only people mostly who look after the cardiac intensive care without really a proper intensive care training. So I think this is that lacuna which can be filled in by not only this journal but this textbook also. Mm-hmm. And it's a huge population which are trainees or residents, fellows of cardiology, cardiac surgery, of intensive care, of anesthesia, and they all require this training to be complete, and it will not be unless there is a proper structured course. And I think this textbook is the first major step towards it.
Definitely, thank you. And Dr. Nanda, your contribution both to the journal and the book is has been always very crucial. How you see the journal growing up and how you see the book coming up?
Well, I think I really am very much honored, to be associated with the journal and also with the book, because I think there's something that previously not much attention has been paid, as Dr. Mehta mentioned, mainly by the surgeons, which is becoming more of a multi-specialty area now, where we realize we cannot do everything on our own, but we need the help of everyone else. Everyone has to cooperate with this. And I think so the journal and the book will fulfill that need. And also, just like Poonam was mentioning, it's the question of what is cardiac critical care, what it is. This is sort of it touches many branches, but at the same time, it is something which is absolutely useful for the patient. When it comes to the patient management, that's very, very important. For example, it's a lifesaver in many situations. And also, I think the course that we are having today, the conference on point of care ultrasound, is very, very relevant when it comes to cardiac critical care, and also the journal of the society. So I think this is something in the leading edge of medicine. So I'm really very happy and honored and privileged to be part of it.
Excellent insights from our experts and authors of the book. I would now just request our publishing director RItu to say how Thieme is venturing into cardiology and critical care up with this new book, and how you plan to take this forward.
Actually, we are very excited about this venture, because when I met Dr. Poonam at first, I could see the passion in an academician to publish a book like this. And in India, we have plethora of knowledge and experience of people, but if we can share it with the world, then we can show that India is not lacking in the specialities and in knowledge and expertise. And to be associated with people like Ma'am, Dr. Nanda, Dr. Mehta, and I think we are really excited and we are looking forward to this book.
So, Thieme Medical Publishers are committed to contribute towards dissemination of clinical information, quality clinical information for the students, for practicing clinicians, researchers, not only in the country but across the globe, and we will continue to strive forward with these adventures. Thank you for joining.